So I am Dr. Devin Savage, inventor of the Archlifter, and I'm here with Dr. Bridget Hennessy, a dentist. She's originally from Ohio, and she is practicing in Germany. And she has an Archlifter. Mm-hmm. And which kind of Archlifter do you have?
I don't know the special name of it.
It's a Type 2.
Type 2. Okay.
Type 2.
Yes, I have the Type 2.
And so I have a list of questions for Dr. Hennessy. So one of the first questions I wanted to know is, how long have you been treating patients yourself?
Oh, I've been treating patients since 2005. I graduated from dental school in 2005.
Yeah. You were also in patient care before that, right?
Well, just during dental school.
Just during dental school? Okay.
Yeah.
Okay, so anyway, yeah, during dental school, and that's at least 2.5 years, even before 2005.
Right.
Yeah. So anyway, so what kind of neck and back problems had you had up until the time you got your Archlifter?
Oh, okay. Well, actually, I started seeing a chiropractor when I was 19 for lower back pain. And I started having issues with some neck pain, also in my 20s and 30s, but I think I made a connection about 10 years ago with my work posture and the neck pain, and I was seeking chiropractic assistance. Yeah.
Okay, so could you give me an idea of what kind of results you had with the chiropractic?
Yeah. Well, it's variable.
Yeah.
So, I mean, sometimes I would have nice results, and I would be months, maybe 3-4 months, where I didn't feel like I needed to go back to the chiropractor.
Okay.
And then sometimes I would want to go back the next week and the next week and the next week. It was variable, depending.
So, sounds like you went through spells where you had more difficulty.
Yeah.
So, and then about how old were you when your problems started, would you say?
How old was I? Approximately. So I guess about 38.
Okay, so you're relatively young, actually.
Yeah.
Relatively young, and already, because of the work posture.
I think so.
Yeah, because you would spend, hours a day treating patients, hunched over your patients.
Well, yes. I mean, we are taught the correct posture.
Right, we're taught the correct posture, but hour after hour, you're,
No.
We know how things go.
Yeah. Yep, it doesn't always work where you can just sit in a perfectly nice, ergonomic way and see everything.
Right. So, about when do you think you made the connection between your work posture and the symptoms that you were having?
Yeah, it became more noticeable about 10 years ago. That's when I was seeking chiropractic care more frequently.
Yeah.
I would say it took about 10 years for it to creep up on me.
Okay, yeah. That's also, it's not a long time, Doctors practice, 25 to 35 years. Yeah. And that's about a third of a career.
I know.
And then you're already having
pain.
You're already having symptoms. Yeah. Okay, so would you say that the chiropractic care, the physical therapy care that you had, would you call that a success?
Not so much, because I would like to be able to take care of these issues myself and not have someone else, like I always have to make an appointment and go find somebody who they can find the problem and can they fix it. They can't feel what I'm feeling. Maybe they can make things aligned. That's good, but what was the question again?
I just wanted to know what kind of success you had.
Oh, success.
Yeah,
right.
like would you call that a success if you spent? It sounds like you spent quite a bit of time. You invested some time in your chiropractic care.
Yeah.
It was time away from your work,
Yeah.
right? Because the chiropractor's offices are open during business hours.
Exactly. Yeah.
And so you'd have to take time out of your day.
Yeah.
Right? Yeah.
Yes,
I don't want to
indeed.
put words in your mouth.
No, that's true, though.
Yeah.
That's true. I did, for a good long while there, I've had a schedule where I can find a day where I'm not treating patients, where I can go to see a chiropractor. But when I had a really big problem with sciatica, when I was working for the military, that was Monday through Friday the whole time. So that was really troublesome, trying to find a time to go to a chiropractor, a very limited freedom in that particular schedule. Success, though, if chiropractic was success, well, when I got 3 or 4 months of relief, it felt successful to me. Yeah. But not, of course, when I would say, "Oh God, it didn't work. I have to go back. I have to try again. You know, I have to try to explain again what is causing me to increase what makes the pain increase, what makes it go away." It was just it's communicating with someone who can try to manipulate then your body, and it doesn't always work.
Right.
It didn't always work for me, I'll say.
Okay.
Yeah.
Did they do any kind of spinal traction? Any kind of traction?
Okay.
Manipulation?
More manipulation. I experienced some traction when I was in dental school. I was already seeing a chiropractor back then. Yeah. And in dental school, he did some traction with the neck. And it was a completely different. I'd never seen it before or after. It was stretching with elastic, and the chair was a certain angle, and then there would be an elastic band on the forehead, and then it would pull the neck back. So that was uncomfortable, and I'm not exactly sure if that was desirable, but I did that multiple times under his care. And then there was another traction at a event at a chiropractic, which was also the neck, and it was just manual traction, just pulling, and that caused an actual release that I then experienced. My body then repeated on its own several times after that. I don't know if you're familiar with that.
Yeah, chiropractic release, yeah. I'm not really sure exactly what is meant by that, but it sounds like it's a type of traction where you, or maybe you're able, the traction itself is able to kind of expand the disc space, making some room between the vertebrae so that the disc has a little bit of expansion room.
Yep.
So I believe that chiropractic and physical therapy is actually able to do that. I think they can do that. It's just that it's a little bit cumbersome to take time out of your day and go there and have it done.
Yeah. And finding the right person.
Exactly, yeah. And another thing too is one of the reasons why I did a deep dive into this more than 10 years ago is that you kind of want it on demand. You need it at home. You don't want to go to the gym, or you don't want to have to go to a specialist every time you need it, because you could need it at a moment's notice. And so anyway, good. Okay, so would you say what would you say was typical for relief? How long was your relief? After a treatment, would you say?
Do you mean with chiropractic?
Yeah.
Oh, that's what I was saying before, with it being so variable. Sometimes I would really feel like a success, something lasting, like pain-free, feeling aligned, whatever that feels like, for several months. But sometimes just it wouldn't last very long at all, or not. It just wouldn't be effective. And then I would wonder, well, maybe the chiropractor isn't able to fix this problem, because they can't do everything, right?
Sure.
Yeah.
And also I was wondering if you had ever been offered a surgical solution to your problems, or suggested that maybe you need to go have a surgery.
My initial answer is no, but there was one time, it just popped in my mind, where it was a TMJ specialist, and this was when I was even younger. because it was not really neck, back, kind of, so I wasn't thinking about it. But yes, there was this TMJ surgery offered when I was in my teens, probably 16. And that was just really scary idea. Yeah. A really scary idea. So I, no.
Yeah. Okay. Let's see. Okay. Can you give me an idea of how often you use the Archlifter and what kind of results you have, and just give me a kind of like a global view of your experience with the Archlifter, the Type-2 Archlifter.
Okay. Well. You warned me to be not warned. You advised that I go slow and be gentle. Right. Yeah. And that is exactly what I would recommend for anybody, to start slow, take it easy. But I was so excited about it because it felt so nice. It just felt so that traction, and then the freedom you have to feel the alignment. So I maybe overdid it at first, but I didn't have any negative side effects from overdoing it that I could say. But I would be using it like several times a day, every day, every day, for the first week. I mean, I already felt great after just a few sessions, immediate relief, immediately feeling aligned. So yeah, I was quite active with using it at first. And then I suppose because I had no pain issues calling out, I need the Archlifter. So I tapered off, and then as maintenance, my goal was to just do sort of like once or twice a week maintenance, maybe just a minute or two, or even less. But I haven't even really been once a week. Okay. It's been more a couple of times a month now. Okay. So a lot at the beginning. That was 4 months ago. Yeah. And then now I feel like I'm just on maintenance.
Maintenance. That's great.
Yeah.
That's wonderful.
Yeah.
Yeah. Okay. So have you? One of the questions I wanted to ask is, have you ever used a back strap?
I don't even know what that is. Okay. Yeah. Okay. I know. So I'm curious about it. But.
Yeah. What that is what it does is it lowers the traction point to below your shoulders. Huh. So you put the back strap under your armpits. Okay. And then it's basically putting the lower body against the upper body from here up. Yeah. And so you're using your legs as a weight. Yeah. And it's mainly for people with lower back problems. Huh. Okay. So. Well, I've already noticed, though, without the back strap. Yeah. So I get little realignment, little tiny movements, right? Here, and then it goes, and then I get a little adjustment down here, and then I can feel it mid thoracic. Yeah. And then if I mean, this was more in the beginning when I was doing it more often, every day, and so then I would just spend time in the Archlifter, and it would just start up here, and then and then hips and knees, and I've even noticed with my feet. Wow. My feet will get this will be not during using the Archlifter. I don't feel anything aligning, but then I start to walk around, and then I can feel a better alignment and balance in my feet too. Wow. Yeah. Okay. So, and I attribute that to the Archlifter because it happens right after using it. Yeah. Okay. Yeah. Okay. Yeah. That's wonderful. Okay. It is. Are you using it mainly at home, or have you ever tried it in the gym? I don't have a gym. Okay. So I have it installed in my home. Okay. And I have it in such a way that I can just attach it, use it, and then detach it and put it away. Yeah. I've also brought it here to the practice and installed it here. Yeah. And to allow for some coworkers to try it. Oh, okay. And I really
would like for us to incorporate that more into having it here. I do have to then carry it here and carry it home. It's kind of heavy to carry back and forth.
It's about 4 kilos.
Well, I already have a big bag on my shoulder and my purse and my coat, So I like that I can keep it at home, and I don't want to leave it here because I like using it at home.
Yeah, sure.
Understood. Yeah. Okay. So with that,
So do you have a ceiling mounted, or can you give me
ceiling mounted? Yeah. I have just the hook in the ceiling and then a strap.
Okay. Let's see. Well, okay. So for my final question, I have here basically, what's your overall recommendation for the Type 2 or the Archlifter in general, and what would you say to anybody contemplating an Archlifter?
Well, I recommend it for anyone who is willing to be suspended by their head.
Okay.
And if they're seeking better alignment, I think that there's probably room for most people to have improved alignment with the way that our ergonomics are here in this modern society that we have.
And how much weight, how much force would you say you're putting on the Archlifter, like pound-wise or kilos? Or
okay, well, my full body weight.
Okay.
And it didn't take long to feel confident to allow my full body weight.
Oh,
okay, but I started off gently, which is what I absolutely positively recommend for everybody. Start off gently. And so it was just a matter of standing flat on the ground in the position with the Archlifter in place, and then just bending my knees and then dropping down sort of into a sitting position almost, and then I can lift up my knees. I can do crunches.
Wow. Okay.
So, and I can incorporate the exercises and stretches that my physical therapist has recommended.
Okay.
So I am also seeing a physical therapist currently, and I am also very actively working on improving my posture for work.
Yeah.
It's absolutely necessary, but also just in general.
Okay.
I don't want to have that iPhone or the what's that called?
I call it screen hunch.
Screen hunch. Okay.
Well, I mean, people call it tech neck or nerd neck.
Tech neck. I've heard. So I don't want to have tech neck, and I don't want to be hunched over. And the Archlifter helps me so much to find where I need to be working on.
Okay.
I can feel what muscles need to be stretched, and then I can do the exercises from my physical therapist, who she helped me to identify which muscles need to be worked on and stretched. And now that I know that, I can use the Archlifter at the same time and gently incorporate those stretches.
Wonderful.
And I can feel the improvement, like you said, in real time. You can feel everything getting better.
Yes. Wow.
Yeah.
Okay. Well, that's very encouraging. Thank you very much for this nice interview. I really appreciate it.
You're welcome.
And and anyway, and I wanted to also thank you for trying it out.
Of course. Thank you for inventing it in the first place.
I feel like I was actually inventing it for myself, but once I saw how well it worked, I realized, wow, this needs to get out there.
Yes.
Yeah.
Yes. Yeah. Yes. I think it could be very, very, very helpful for a lot of people.
Yeah. Okay. All right, so that's our conclusion for this interview, and I want to thank Dr. Bridget Hennessy for her very nice comments.
Oh, you're very welcome.
And great. All right. Bye all.
Bye-bye.
Dr. Hennessy then agreed to demonstrate for the audience how she uses her Archlifter. Mm-hmm.
Yeah,
Okay.
that's a typical session for me.
Oh, that was quick actually. I wanted to also show the viewers what setting you have it on.
Oh yeah.
Okay, she
Does
has
it
it kind
seem
of right
like
in
the
the
right
middle.
setting for me?
Yeah.
'Cause it feels right.
It's pretty even, like it's horizontal really.
Really?
Yeah.
That's what it feels like, but it's hard to see yourself
Yeah.
when you're in it.
Sure, yeah.
Yeah.
Well, I like your rig. It works, and
Yeah.
and you can just put it up and take it down when you need it.
Oh yeah. Yeah.
Okay.
I really love it. I really love it.
Wonderful. Okay. Great. All right.